Happy May. Can't really believe it's May 17th. It's just, I don't know, rocking my brain. Well, I am happy to see that we've got a few more people jumping on, and that's great. So we'll expect that there'll be a few more joining us after we've gotten going, but that is absolutely fine. So let's get going. Okay, so here is our agenda this morning. We'll take a few minutes just to kind of orient folks and say good morning. We'll talk about a few announcements and updates. Then we want to spend a good chunk of time talking about cases. We have a couple this morning I'm excited about. And we'll be paying attention to time, at least in terms of our first case, to make sure that we do that in a timely fashion. I know that there's a hard stop for some of those folks a little bit before 9:15. We're excited to be able to show you the medical home portal that has recently undergone a redesign. So Athena, Parker, and myself will be showing you that, and then we'll wrap it up and let you get on your way. All right, so we've changed a little bit about how we do introductions, and we're going to try and leverage the power of Zoom and also take back some time as a result. So in Zoom, you can rename yourself, and you can do that by mousing over your window to those three little dots in a blue square. And when you click that, you'll see some options like you see on the slide, and you can rename. And I would encourage you to do that if you don't mind. And we'd love your first name and your last name. And if it's possible, if you want to, please also put your role and where you work, or, just a minimum, because there's not a ton of room there, but a minimum of that information would be super, super great. I like doing it in the Zoom profile, because that stays, right? If we do it in the chat, that's also fine, but then you have to scroll back up to the top to kind of see. If you mouse over, you can always see what the Zoom profile has been named. So I want to encourage you to do that. The other thing that I'll just say is, once you've done that, Zoom allows you to chat with individuals on the meeting. So if there is someone you'd like to connect with, that would be another way of doing it. Rather than doing a chat with the entire group, you could actually kind of connect with them that way. And I think, hey, if we're living in a Zoom world, let's utilize Zoom. So there we go. So I'd sure appreciate it if everybody would try and utilize that feature and let us know who you are and where you are. I also love that some of you have put an image in your Zoom profile. I have done that on one of my Zoom profiles, but not the other. It's a little confusing. Maybe we'll look at that another time, but it is kind of fun if you're not able to have your camera on the whole time. It's kind of nice to also know what you look like. So maybe we'll do that next time. We'll have some mini Zoom lessons as part of all of this. Okay, so let's talk about some announcements. Oh, well, and I'm Mindy Tueller. I hope everybody knows me. I think we might have a few new people on here, so that's exciting. I am the Director of Operations for the Medical Home Portal, which we'll be talking about today. And I am the facilitator for this meeting, and I have been doing that role for a long time, about 8 years now. All right, oops. Sometimes, though, Zoom is challenging. All right, so announcements. Wanted to let you know what's going on with our pediatric project ECHO that we are a part of through the University of Utah. So we've had a couple of pretty cool presentations since this group met last, and one of them was about transition to adult healthcare. I thought it was really well done. It was on the 3rd of May, and it was done by a couple of med-peds providers who work in university health system. It is recorded, so if that's of interest to you at all, you could go back and take a look at that. And that link on this slide takes you to where all of our information is and to where the recordings live. But we will also make sure that gets sent out in the summary of the meeting that we send out. We also had an acute kidney injury presentation on the 10th. We have another one today at noon about obesity and type 2 diabetes screening. I think that should be really interesting. So if you're able, you could totally join us today at noon. And then we have another one at the end of the month about autism, part of our sub-series around Autism 101. And this one should be very interesting: developmental, behavioral, and educational interventions. And we will continue to have a number of Autism 101 presentations monthly throughout the summer. But we, on the 17th, or today, we're wrapping up our spring session. So kind of looking forward to a little bit of a break. Not quite so many of these, but they've been terrific, and we encourage you to check those out. All right. Nope. There we go. Okay, so medical home portal updates. Well, we have a ton of content in the last little while because we were sort of busy getting a redesign out there. We're excited to say that happened on April 21st, and now we are doing a lot of cleanup and taking care of little things. And so you might notice that if you're on the site. Please bear with us and also let us know if you see things that don't seem quite right. We appreciate any extra eyes on there. That's really helpful. But yeah, we're very pleased. After a long time and a lot of work, we've got that redesign out, and we're going to show it to you later today. And since that redesign has gone live, we have added one more care process guideline. We're really working to get a lot of these out right now, and they're pretty useful, I think. We're rather excited about them. I think I'll show you the algorithms and guidelines area of the site in a little bit, and we'll take a look at this latest one: outpatient urinary tract dilation care process guideline. Whew, it's a mouthful. Okay, well, I am excited to get to the brainstorming part, the case part of our meeting today. And we have a couple of cases, and I really appreciate Heather Carlson and Julie Southwick, and maybe others that I'm not aware of yet, who are going to do our first one. So I'll just go ahead and let you take it away, Heather, if that's all right.
Thanks, Mindy. Yeah, good morning, everyone. So we have a case to present, and I'm Heather Carlson. I work for the Integrated Services Program, Department of Health and Human Services. And I had a referral from Systems of Care, the high fidelity wraparound services, for a 17-year-old girl with multiple diagnoses. Some of those diagnoses included like celiac disease, autism, fibromyalgia, suicidal ideation, bilateral leg weakness, and POTS. She's on probably 15 plus medications, having some issue with schooling and other things. So through Systems of Care, we brought some people together and started meeting with this mama every other week. The people that they included in that in those meetings were us through ISP, myself and Natalie Allen, our APRN, and DSPD. At times, people from the medical community, like from the dysautonomia clinic, would join us. We had Utah Parent Center involved, which was wonderful. So we've been working on several different things. So one of the things, we referred to genetics. We worked with DSPD, and she was granted some emergency one-time funding, which will be great. She'll get to go to a summer camp this summer, sponsored by DSPD. We coordinated with schooling issues, especially Utah Parent Center did that. And one of the biggest things was transitioning to adulthood. And she will be turning 18 soon. And so that was a big factor for mom and for the daughter. And so Julie Southwick came in, and she's through our Integrated Services Program, and she does a lot of transitioning into adulthood. And so I wanted to turn it over to her. So I thought this was amazing. So if Julie, if you'd like to go ahead and take it from here.
Thanks, Heather. I was brought on in April to join the care team for Marcy, for the family, and they decided that I could just contact the mom and work with her as to her needs. So we talked, and she wanted to meet and discuss guardianship and several other things. So Colleen Kenny is amazing at Utah Parent Center, and she helped me with another family that just had a lot of anxiety and worries about what was going to happen. So we met a few weeks ago at the Utah Parent Center, and we sat around a table and started to talk about the things that she might need help with. And we talked about school, we talked about the guardianship, but then she started to get into the medical, and she showed us a list of all of the medical diagnoses. And I noticed on one of those was POTS, and we proceeded to talk, and she said, we do have an appointment with the geneticist. And I said, oh, you know, we talked about some of the other things she had, and she was talking about, she had a Broviac catheter, and I said, what are you seeing the geneticist for? And she said, well, we are seeing if she has an Ehlers, and she couldn't say it. And I said, Ehlers-Danlos syndrome? And she said, yes. And my daughter has Ehlers-Danlos syndrome. So it was just this wonderful connection. We just started to talk, and I said, you know, POTS is one of those things. I also asked her about, you know, does she have skin issues? And she says, oh yeah, she has, you know, when she gets IVs or anything, the tape tears her skin off. And I asked her about anesthesia, if she had problems with that, and she said yes, we can't get her numb. And all of these things are mast cell activation disorder, and POTS are usually seen in EDS patients. And we just had this connection and started to talk about it. She didn't know what it was, and we had a great discussion, and I was able to kind of explain some things, and had a lot of things that her daughter had, I think, are associated with the EDS and not just random. And we just had a very great conversation. We all three of us kind of ended up very tearful. She said, I know we are all supposed to be here today. And Colleen pulled up the Ehlers-Danlos information on Medical Home Portal. And there is one, I think it just kind of talks about how to, it's just a graph, I think, how to diagnose. But I mean, Mindy, maybe we can add some more things, because there's so much to know about it. And I think this mom was just really kind of put her mind to rest to kind of know what that involved. And it was just great for the three of us to be able to make that connection and talk and be able to help her. So I hope maybe
Oh my gosh, Julie, that is so cool. Yeah, of course, my brain's going fast. And for those of you who, well, probably the majority wouldn't know this, but Julie and I know each other from a long time ago. And so I've been aware that her daughter has EDS. And yeah, no, it would be, I think it would be great to try and get some more information around that. When we try and get in-depth information on a chronic condition on our site, it's a big process, a big process, because we not only need an expert to write it, but we need somebody to maintain it. And so but I hear what you're saying, and I've got my wheels turning, and I am so excited that you were the person who got to be at that table for that family. That is amazing.
It was great. And I think that there's more awareness around EDS now. When my daughter was diagnosed, I didn't know what it was. It took several years, but I'm happy to help in any way because I've been doing this for a while with her. So I have some connections, and I'm happy to help do whatever to make that happen. So.
Very, very cool. Well, you will be hearing from me, and this is great. So this family has some things to hold on to now.
Yeah, we keep in touch now, and she's had some questions, and I think she'll probably find out if she has that mast cell activation disorder. It sounds like she does. That's a lot of the symptoms, but kind of gives her some answers. It's not curable, but it gives you some answers. So she said, that a lot of times she went in and everybody said that she was crazy, or it was in her head. And I totally understood that, because we went to a rheumatologist, and the rheumatologist told my daughter that she was just depressed and it was in her head, and wanted to give her an antidepressant. So this mom, I mean, it validated her feelings of not being heard, and that she was just making it up. So it was just a really great meeting.
Awesome.
Oh my gosh. I feel like this touches on all kinds of things, right? Beyond what you might expect in care coordination for medical stuff. It touches on advocacy. It touches on motivational interviewing. I just kind of, so much of what an experience is our perception of what's going on, right? And so if you're able to help validate that they are really experiencing this, that's so huge. That is really
I think it really some of these teens, they're worried about being able to advocate for themselves, which is rightfully so, with some of the care providers that make them feel like they don't know what they're talking about or belittle them. And I think we have a long way to go to, when my daughter, she said, why would I ask that question? They just, talk down to me or think I'm being dumb. So I think there's just a lot of work that way too. So.
Mindy, I have a comment. Sorry, I'm driving, so I'm not going to turn my phone on. But I think one of the key parts of this whole case study was that a single person alone could not handle the needs of this family. It took a team of multiple individuals and agencies to actually make progress for this family. And I think that that's something that to be remembered about, how important it is that that we need each other as care coordinators and teams and all different sorts of agencies. So I appreciate all the people that were able to participate in this care coordination.
Oops. Sorry, guys. I'm going the wrong way with my slides. Yes, Natalie, you are so right. That is definitely a takeaway. And I think that's, if I can toot UCCCN's horn just a little bit, I think that's rather the point of why we gather the presentations around, certain topics and from organizations. Those are great. We want to learn, we want to know what all the resources are out there, but at the end of all of this, a big part of what this is to connect us so that we can ask for help when we need it. And of course, we've seen when we ask, everyone rushes to try and help, and it's just kind of remarkable actually to watch that happen, and so cool. So I love that, and it's really been so neat to watch ISP come into fruition and see what you guys have been able to do. So big shout out to Eric, who I think is on vacation, if I am not mistaken, but well deserved. And you guys just do such a wonderful job. You're such a resource, and we really appreciate that. Along with Utah Parent Center and Utah Family Voices, who are mentioned every other sentence typically in our cases. So I think we're super fortunate in Utah to have some of these resources around care coordination. That's just tremendous. Well, I don't want to take over the conversation. Does anybody have any questions for Heather, Natalie, Julie around this case? I feel like maybe we heard a little bit about this one before, Heather, and this is we're a little farther into it now. I could be wrong.
Sorry, it was muted. No, yeah. That's true.
Mhm.
And it's really nice that I can't say enough about systems of care and the high fidelity wraparound service, because they're the ones that really initiate bringing everyone in. And it was just, they're a fantastic group of people as well.
Shout out there for sure. Any questions?
You know, Mindy, I just want to say thank you to Colleen Kenny, because she's amazing. She has so much knowledge, but more than that, she really connects with these families and these parents. And I just saw this mom just kind of, oh, okay, I can do this, and just gave her some encouragement. But she knew that she was a mom and had experienced it, so that went a long way with her. And she's awesome.
Tina's
That
over
makes
there.
me so happy. And Heather, you know, originally I was supposed to be part of that group, and some things happened and I couldn't be part of it. But I think it was the right connection after all, because Colleen, you know, we're always there to back each other up when one can't be there. So I think it turned out perfectly.
I agree. And the fact that Julie and Colleen met Mom in person,
Mhm.
I think was huge.
Yeah.
That was pivotal.
I definitely picked up on that when Julie was saying, and we met and we sat around the table, and gosh, I just think this virtual thing, while it's convenient, it often limits the potential outcome in so many ways. So I was really, really thrilled, and that takes time. That takes time, and time is money. So the fact that Julie was able to do that Colleen was able to do that they made it work with the family schedule, that's a big deal.
Yes.
Big deal. Very good. All right. Well, I have a feeling Heather will want to ask for more updates on this case. It's really fascinating. And of course, so Julie, did you say that the genetics referral has been scheduled? Is that underway? Okay.
Yes, it'll be in August, I believe. So
Nice.
Oh, that's hard for them to wait till August, but okay.
it is. But I was kind of surprised they got in, actually, because we were on a wait list for like 4 years in
Mhm.
Seattle at Seattle Children's Hospital, because there wasn't anything at primaries at the time. So I think
August isn't really too bad,
So I
honestly.
think she's really happy with August. So
Yeah.
I'm just going to flip that right around. That's wonderful. That's great. Oh my gosh, Julie, seriously, you had to wait. You were on a waiting list for 4 years?
it was, and yes,
Outside
But-
the state.
outside the
How many
state.
years
but,
ago was that, Julie?
Pardon?
How many years ago was that?
Oh gosh, maybe 10.
Yeah, I think
But
things have
I
gotten
connect-
better.
I
over time.
connected with Dr. Ball through, I was working with the Utah Birth Defect Network, and we did a thing at primaries for Zika. And I asked one of the neurologists, do you know about this? And he says, well, she does. And it was one of the residents. And she took my number and put it in her scrubs. I thought, okay, I wore scrubs for 20 years. That's not going to happen. But that was in the morning, and that afternoon I had an appointment with Dr. Ball on Monday. It was just like unbelievable. So yeah, things are getting better.
Nice.
It also makes me, I don't know. I'm just thinking with what Julie just said about connecting with the right person at the right time, how often that those opportunities don't come around for families, right? Because they're not in the right place at the right time. They don't know what they don't know, all of those things. They're not comfortable advocating for themselves. And that's where we need to be careful, thoughtful listeners, and then try not to let those pieces of paper go through the wash in our scrubs, so to speak, right? So, wow, very cool. Well, thank you guys so much. This continues to be a very meaty case, and of course we wish this family all the best, but it sounds like maybe they're on the road to getting some answers. And it sounds like the transition is gonna go okay. Okay, that's huge. That's wonderful. Thank you guys so much.
Thanks for that, Mindy.
All right, now on to Tina for another update. And yeah, lots to hear here.
Mindy, I don't know if you saw that I sent you a cute picture and you probably didn't have a chance to get it over, but
Oh,
hi
I'll
guys,
look for it.
I'm Tina. I'm a parent consultant with the Utah Parent Center. And we are going to present my son's case today. I think that some of you may know that we've had issues. I haven't been around a lot. So I'm going to give you the quick rundown and then a few highlights of this. Let's say from February 14th to today, I'm counting today because we are still dealing with some things. My son has become aggressive, angry, everything. He is not at baseline. And it started on February 14th. His school nurse was punched in the face, kind of pounded in the face more than punched. My son is small. He is about 107 pounds, which we worked really hard to get him there to 107. He is 23 years old. He was born at 28 weeks. He spent his first year of life in the newborn ICU. He's had 20 surgeries. He is not a frequent flyer at the hospital, believe it or not. Adam lives with hydrocephalus, cortical vision and hearing impairments that have really improved over the years. He has a tracheostomy because he does not have a patent airway without it. He has chronic lung disease from prematurity. He has cerebral palsy from his hips down. What else does he have? He has a lot of stuff. He has chronic lung, I think I said that. And then he has autism, pretty severe, nonverbal on top of it. Oh, and so anyway, like I said, starting February 14th, something changed with him. And Adam has always had the ability to be angry. He's got quite the attitude when he wants to. He knows what he wants when he wants it, all of those things, but has never, ever hurt anyone. The only thing he has ever done really is just bit his own finger when he was frustrated. That's about as far as he would get with his frustrations. So things have changed. 1,000 things went through our head because if you listen to all the systems he has involved, it's like, where do we start? The other thing is he does not have the ability to make the connection of it hurts here or it hurts here. We've tried everything. Everyone has tried everything to get that communication, and he just he's been a very hard one. I had, back in the days when the CSHCN clinic was still running, the speech therapist there said, yeah, I was your son's speech therapist at school, and he was probably the hardest kid I've ever had. He just doesn't communicate well as we'd like him to. As March went on, so we were seeing these spurts of anger. They turned into days of anger, and it didn't stop. And the dates are going to be really blurry, guys, but this all happened in the last 3 months. The first place we decided to stop was primary children's. Adam had never, at 23 years old, he had never been seen in an adult setting other than his primary care internal med doc. That is really great. He, like I said, is not a frequent flyer at the hospital. Our decision was to take him to primaries and say he's never been seen anywhere else. And can you help us? We need to figure out what's going on with him. We need to run some tests. And so they did bring us into the ER, and we met a doctor that was his doctor in the ER that day, who basically walked into the room, saw a young man in distress, obviously, and looked at my husband and I and said, let's talk about the most important thing right now. And we said, okay, what is that? And he said, Adam is over 18 years old. And at that point, I looked at him and said, okay, we need to pack our bags and go. I don't have time to have this conversation. I brought him here for a reason. He's never been seen anywhere else. The doctor continued to argue with me. He asked me, what do you really want us to do? And proceeded with having us tell them what to do. It was a very weird situation. He claimed he was trying to do something called shared decision-making with us. And it was the oddest trip to the ER we've ever had. Finally, I asked the doctor, okay, you're the doctor. What would you do here? You know, I told him, you know, he's a shunt. Let's look at his shunt. Let's do a urinary, you know, test his urine, test his blood. Let's see what's going on. He looked back at me and said, well, I personally would send him home. And mind you, Adam needed oxygen and wouldn't keep it on at this point. That was one of our main reasons for bringing him. And I said, why would you send him home? And he said, we see kids like this all the time. So that was our very first experience walking into 3 months of distress. At that point, I got very angry at the doctor and I said, if you're going to share decisions, let's share some tests and figure out what tests we're going to run. And he got really mad and walked out and said, I'm sorry I offended you. And I never saw that doctor again, but guess what? The nurse came in and there were lots of tests ordered. So that was, like I said, one of the weirdest experiences we've had. You've probably heard me talk about walking away from the ER with Miralax, and that's what happened that night. They couldn't find anything in the tests that they were really willing to run. And so they said, well, he doesn't look constipated, but maybe he is. So here's a bottle of Miralax, take him home and clean him out. We went home, cleaned him out over the weekend. We cleaned out a very angry man over the weekend, and nothing really changed. We tried a lot of over-the-counter meds for him in case it was pain, and nothing was ibuprofen, Tylenol, combinations of those two. Nothing was really working. A few weeks went by and we didn't know really what to do. I ended up calling in a few connections that I have. I used to be a board member at Primaries, so I have a few numbers, and I called a couple of people and I said, how do we do this? Can we get him in and get some more tests run? Can we look at his teeth? One of the things about Adam is he will not let you get in his mouth. So a regular dentist could never, ever look at his teeth. The administrative people at Primaries helped. It just so happened that Primaries was full. They were on like double bedding and all that because of the flu and all the respiratory things. And so it was kind of a forced transition to adult health care hospitalization, which in the end will work out fine. But Primary Children's actually did a great job bridging us over to LDS Hospital. They made sure that there were some child life things for him there, because they knew that he is a case that has to have some child life around for an MRI or anything like that, which was beautiful. Hospital administration met us basically at the door. What worries me as we go along in this story is not everybody has those phone numbers to call. We happen to be very fortunate in that manner. We stayed in the hospital. They admitted him that night. The first thing we did was spend a few hours in the ER. I mentioned to the nurse that needed to get blood from him that she would need Versed. It is a necessity to give him some nasal Versed or through his G tube in order to get him to calm down enough to even let you touch him, especially if you're wearing scrubs in a hospital setting. she said, well, we don't do it that way here. Can we please try it without medication? And I made the mistake of saying yes. And Adam went through 2 hours of people trying to poke him, all the way up to his, literally up to his shoulders. They finally got their IV and we got to go upstairs. And we spent 3 days in the hospital with no real answers. By the end of the 3rd day, we thought it was headaches. I asked the hospitalist to please try a headache cocktail. This was just a thing we grabbed out of the air, thinking all these storms are happening, maybe it's headaches. And lo and behold, that headache cocktail seemed to do something. It changed. Now this was Toradol and Benadryl. Toradol is a higher level of ibuprofen, basically a prescription level. That needs to be used very carefully. And so that was an aha moment for us, because that's an inflammation med. And it gave us an inkling that he's got some inflammation somewhere. We came home for about a week and he went back into being angry again. He had a few great days, really, really great days. And that's him, by the way, isn't he cute? So came home, we knew it was that. We went through a week of that. We went back to the ER again. They gave him a different inflammation med. That one helped even more. It was called Celebrex. And again, a couple good days. In the meantime, his parents are using up all of their paid time off. He literally can't be handled by anybody else but us, because he's injuring people and us. And so again, we had the Celebrex couple days. That was good. And things started ramping up again. So we called dental. And that was the next thought, is how are we going to get in his mouth and look at dental? Just to let you know, we do get him to the dentist, Medicaid as an adult, and they drive everything. We've got him triple covered on everything he could be on. But Medicaid drives the idea that he can only be seen every year and a half, basically. And that is because he goes into specialty dental. And in Utah, there's one dentist that does this type of work. His name is Dr. Coleman. He's up at the U. And he also does a few days at MCHES Hospital. He's about a year out right now for appointments. Again, I made some phone calls and asked the people that be at Intermountain if they could get him anywhere that has in-house dental, and we know Primaries does, and they took some steps to get him into MCHES Hospital on an emergency basis. I had to do a lot of talking and convincing Dr. Coleman that we've run every possible test, we've done every possible thing. And he happens to be a great guy that will call you after work and talk to you as long as you need to talk, all those things. So we finally decided, let's get him in, let's see if it's the wisdom teeth. And he should have been being seen about this time, but everything, kind of went haywire over the last few months. So we ended up, getting up at 5 a.m. and getting him to MCHES Hospital in Ogden on the 13th of April. So we're going now from February 14th to, that's 2 months. And spent the whole day there. And it's a beautiful clinic, guys. I love that clinic. I gotta say, they do a really great job at accommodating people like Adam, for sure. And they did find a very, very impacted, very sideways and attached to the jaw wisdom tooth. So we went ahead and took all the wisdom teeth out and did a teeth cleaning and got him all good. And he came home on a little bit of codeine and Tylenol, and he was happy. He basically looked like any other kid who had their wisdom teeth removed. He laid on the couch, wanted his mom, next to him, watched TV for a while, fell asleep, just your basic, like my daughter was when she had hers done. So that was on a Thursday. By Sunday, we had ran out of codeine, and that was not a good thing. They did not prescribe enough for what he had done to his mouth, unfortunately, and we couldn't get a hold of the doctor until Monday afternoon. And this doctor is in the OR 12 hours a day. He called me from the OR. He had his nurse calling me while he was doing teeth, and they figured out a way. By 6 p.m. I got up to the U and got a prescription for him and gave him his first dose. And mind you, he was ramped up. Now I'm in pain and nobody can do anything about it. Tylenol, Motrin, nothing's working. And so by evening, he was settled back in after a dose of this codeine Tylenol stuff. By midnight, we gave him another half a dose to get him through the night, keep him asleep. And at 3 a.m., luckily we had him right next to us, right next to our bed. And he popped up in a panic. We woke up and he was satting in the 60s, which I think all of you probably understand oxygen saturation. He was about 62 when we looked at his sats. He had aspirated. And so we called an ambulance, got him up to LDS hospital, and they admitted him and took him into the ICU. That in itself is a long story. The experience was good and bad. They need to learn a lot more about autism, sensory issues, things like that. LDS has a flagship ICU for a lot of reasons. They've done beautiful things. They were like better than most during COVID. A lot of great things happened there. And they came to us and said, we don't tie people down here. We don't strap people down in the ICU here. And Adam's hard. He will hurt you. I promise. Like, I don't leave him alone with one nurse in the room because he will hurt her if he's in this type of fight or flight mode that he's been in. And what we figured out several hours later, is their protocol is to be more humane and hold people down. If they need to be held down, they use their hands, right? It's completely, you got to flip that. You got to flip it completely for someone with autism like him. Not everyone, but like him, he, on a good day, doesn't want you constantly up in his face touching him. So what happened during those several hours where they were holding and having my husband help and me help hold him down, and people were getting hurt in between holding him down, is that they tried a lot of drugs to calm him down. The first one they tried was fentanyl. Nothing. I'm not kidding you guys. He did not respond to fentanyl. His adrenaline was so high that he was in a true fight or flight. Then they tried oxycodone. Then they tried a drip of something that started with a P. So you nurses, I'm not sure, I can't remember what the drip was, but at that point, one of our nurses walked by and said, gosh, that should have knocked down a guy 3 times his size. Nothing. And that's when I asked them to please stop holding him down and get some straps. For him, it made the most sense because he was only fighting the straps at that point. So just keep that in mind. Some people, it's not going to look the same. It's not going to, especially this one, everything looks different with him. Long story short, some things happened up there that I'm going to try to help fix at some point. They gave medications they didn't tell us about. They did things they didn't tell us about. They would tell us go home and sleep for a couple hours, and we come back and there was a lot of changes made. There were psych meds started. There were like things that we did not ever hear about. And once we found out about them, I asked the doctor to sit down at a conference table with me and whoever she wanted to bring in the room so they could understand what legal guardianship meant. That ended up somehow, oddly, in a weird way, miraculous way, turning into administration coming down and talking to me about a board position over all the adult hospitals in Intermountain that is a caregiver of an adult with a disability. So that's up and coming. I need, Intermountain takes a long time to do things, but we've created something out of a bad situation. But my thing is, guys, this is a young man with severe autism that was in pain. Now that we're home, he's doing good, but every night between 2 and 4 a.m., he wakes up in fight or flight mode. This is still happening. It's something that we don't know how to fix right now, except to bring him out of the panic where he doesn't know where he is until he finally looks us in the eyes. And yeah, so he's experiencing trauma, which, so are me and his dad and his sister. But long story short, we are okay. I worry about the families that don't have the knowledge that I have, or don't have, I'm gonna, say that the guts that I have sometimes to take people to the table on things and what would happen. And what makes me afraid is that people that don't have strong advocates and that support around them may never be understood. They might be pegged as a psych patient and they're really in pain. And that nonverbal piece is really hard. So that's my story. If anybody has any great other suggestions for this kiddo, that would be wonderful. But that's kind of where we're at with this case at the moment. And the adult care piece is important. For people that are in the Valley, LDS is going to be putting together some education for their employees on autism and sensory issues. It would be probably a good place to bring your individual with autism if you need to, because they are on board to say, okay, we need to learn more.
Wow. And I've heard that from Tina before, but it still just blows my mind. Does anyone have any questions or comments? Eva does. Did they rule out Cushing's?
Cushing's. I have not heard of Cushing's, but I'm writing it down right now. Thank you. What is Cushing's?
It's a syndrome that affects the adrenaline system, and it looks like it kind of mimics a lot of symptoms that it sounds like your son is having, fight or flight, other things, but I've seen it on medical shows where, it was mimicking other things, but anyway, just a thought to look into.
Thank you.
Yeah, Cushing syndrome.
Okay.
Thank you, Eva.
Yeah, the adrenaline piece is the real clincher for us. It's like he had a security guard outside the door of his room, and he's 107 pounds. I don't know. But one thing, guys, you're gonna laugh at, when I did take that doctor to the table and sit him down and talk to her about what she can't do and what she can do. And I did tell her she's amazing and she saves lives, and I appreciate her. But at the end of our conversation, I said, okay, guys, now you know where Adam gets his adrenaline, I guess, right? Yeah.
Natalie says in the chat, I am overwhelmed with emotion. Thank you for sharing this today. So many lessons to be learned. You are such a wonderful advocate for Adam and all individuals and families dealing with similar situations. Thank you so much. I mean, you guys have gotten to know Tina a little bit. Some folks on the call today are new, but many know that, Tina just has this sort of even keel approach that it's quite something, right? And my guess is that some of it's been learned over 23 years. And some of it, I think, is just who you are, Tina, but it's we all need to be a little bit more like Tina. And I think we can really learn from how she handles this, because she was able to not only take a bad situation and make it into a learning situation for this doctor and team, but it looks like it's going to develop into something that's positive for Intermountain overall, and it's going to transcend just this one situation. That said, I think that there are still going to be times in Intermountain and LDS scenarios where somebody didn't get the training or didn't remember the training, or, people are human, and we still want to really always help support families to know that doctors, that care team, they are human, they forget things, they make mistakes, and it is okay to ask questions, to challenge. Hopefully you can do it in a respectful way, but be the squeaky wheel. It's okay. It's more than okay.
Well, and again, it's me. I lived in a hospital for a year when he was born, with him, basically. I didn't leave often. So I knew things like, oh, I can go down to archives and get the records from this day. It's really interesting now. There's no more, I'm so old, you guys. There's no more paper record at the end of the bed that you can pick up and look at. It's in their computer, right? And there's this other thing that they do now too. There's a nurse that comes up on your TV that takes all the notes. Like the nurse that's actually physically there with him is repeating it to her. Like, it's so high tech. There's so many things now. But so, I did pitch a fit a couple of times. I wasn't the nicest person, I have to admit. But I do know how to apologize. And that goes a long way. My adrenaline was up too. But, I said, the doctor said, I want to meet with you. I said, nope, I'm going downstairs to archives. She's like, what do you mean? I said, I want to read everything that's been done with him since we've been here, because I don't know, obviously. And it disturbed them a little bit that I knew how to go down there and request records and have them printed out in a nice little packet for myself. But we have that right. We have that right. It is, and so she couldn't even believe. She's like, I'm not even done with those notes yet. And I said, I know, you can finish them and I'll get the rest, but it's just kind of the way that the more you know about advocacy, the better off you're going to be. We're not out to hurt anybody, sue anybody, but I do want to know, like, how many other meds did you give that we don't know about, those kind of things. And I think she, in the long run, appreciated it. Her main comment, as she had tears coming out of her eyes, was, I'm sorry, I didn't know the history. I didn't know the history of the drug that we gave him. And there was a history behind it. We had given it, it was a bad drug for Adam. That's why I was so upset. And I said, the key thing is you didn't know. And if you don't know something, you ask. Okay, all you have to do is ask. The other piece to this that's really interesting is, when I mentioned it to the nurse administrator over LDS, she got out her little notebook. She's really cool. She takes notes on everything because she wants to learn everything, and she wants all this autism education. She's great. But she, sure enough, pulled her notebook out. We got to teach everybody here about legal guardianship. And I'm like, come on, Adam cannot be the first individual that has had legal guardianship over him come into this hospital. Why don't we know about it? The word legal is in there, you guys. You're lucky it's me, and I'm not like some sue happy person, because there are people that would just do a lot of damage, or at least try to. So it really, I think that's why we need a position like this on all hospital boards, so that a legal guardian can be represented and they understand what that really means. So anyway, it's fun, navigating these systems, that's for sure.
Yeah. And the adult system now, and there's going to be more young adults in that system and young adults whose parents and others have legal guardianship. And it's that partnership. It's when you need to ask, it's because I know I'm the expert for my child. That's why you need to ask. You're not.
And I understand too that there are families that are going to be more,
Thank you so much.
they're culturally, sometimes there are families that are gonna, the doctor is gonna do what they need to do, but they still need to know what they're doing. That's the thing. So
Thank you
yeah,
so
guys,
much.
that's my story. Oh,
Really, really great. Okay, well, keep us updated on how things are going.
okay, and I'm gonna look into this Cushing's because that boy's got some adrenaline problems for sure.
Wow. Okay. Let me pop this back up here into presentation mode. There we go. All right. Well, thank you for 2 really powerful cases, guys. Really something. All right. So we'll switch gears a little bit now and we'll talk about some new resources we wanted to spotlight. Are you, Athena, able to talk about these?
Yeah,
Okay,
I'm here.
great. Okay.
So I just wanted to make everyone aware, this is an ABA therapy resource that came in this month. It's called Honey Behavior Analysis, and they're fairly new and they do offer telehealth. Currently, there's no wait for their telehealth options, so that's a good one, and possibly would yeah, they're available statewide as well. So I thought that was a good one for everyone to know about. And then Mindy and I were able to attend the Association of Maternal Child Health Programs conference at the beginning of this month, and had attended a workshop that had panel members from the Frist Center on there, which I had never heard of. And it's called the Frist Center for Autism and Innovation, and they do some really, really great workplace and work advocacy for those with neurodiversity, and all over the country as well, not just in Tennessee. So they have some, like I just put some of the services on here. This virtual summer coding camp is an option open to anyone. They have summer internships. They do job matching, job coaching, employment readiness. So some really, really great services for those with neurodiversity.
It was so neat to hear about this. So yeah, and they're really interested in connecting. So happy to talk with individuals about what's going on, in whether they're the individual with autism or someone who cares about them, all of that kind of stuff.
Yeah. And I can't exactly remember, but I want to say the virtual coding camp was it was either ages like 12 and up or 14 and up. So that's adolescent age frame.
Oh, cool. And we'll make sure we get that in the summary as well.
I should ask, are the services free or on a sliding scale?
So I believe most of their services are free. That is a great question. I didn't see so I think they do some training for workplaces as well around neurodiversity, and those might cost, but I think a lot of their services were free. So if
I want to say they're nonprofit.
Yeah, it seems like
right now.
So Mindy, if you scroll back up to the top, and there's a little button that says programs, a little bit more to the top, sorry.
To the top. Oh, sorry.
There we go.
Here.
So
Okay.
yeah, if you click on that coding one, they've got that. You've got some of those programs listed out there. So maybe just click on that. I think there was an application required, but I don't think, I didn't see any costs associated with it, but.
There's free.
Oh, yep. Thanks.
I know that I walked up and talked to the guy that runs it. after the presentation, and he was happy to just have me call him. He said, call me. I want to talk to you about your son. We need more time to talk about him. And so they're very open to, you know, helping in any way they can.
Yeah, they have a lot of great tools and resources, so. And
Definitely.
for all spectrums of neurodiversity as well, they were really emphasized that, so.
Definitely. All right. Thank you, Athena.
Mhm.
Okay, so let's talk about the Utah Medical Home Portal now. This is our new look. Pretty excited about it. It was a long time coming. One of the things that I'll point out is that the majority of the photos on here of individuals and families are of Utah individuals and families. So we actually worked with a photographer, a local photographer who often works with families with children with special health care needs. And so these are original photos of Utah families and kids. So we're pretty excited about that. So pretty different look and feel, big departure from our last site, which we got a fair amount of feedback that it was a little bit clinical looking. It didn't feel quite so family oriented. So we hope that this has changed that a little bit. The content is essentially the same, although in a couple of cases, we've moved things around just a little bit. So it might take a little bit of looking or searching to find things again. But we encourage you to do that. We have our little disclaimer up here at the top, because anytime you roll out a project of this size, there are going to be little stragglers that need to be addressed. And what we found is in addressing some of those, we've created a few other little problems. And so we're playing whack-a-mole right now, and we appreciate your patience. But I think the site search is having a little bit of an issue right now, and we're going to work on that right away. But I'll just take a minute, and then I'll turn it over to Athena to show you part of it. I'll just show you a little bit of what we've got. So one of the sections that looks fairly different is our parents and families section. So we have divided up what is our diagnosis or condition focused information into its own section here called Learning About Diagnoses and Conditions. And here we have our frequently asked questions and answers. And these are, we try and mirror what we have in the clinical section with these. We don't always have a one-to-one ratio, but we're pretty close. So if we have in-depth information on Charcot-Marie tooth disease, we try and have a corresponding FAQ for families. So I'll just, all right, might have a bug there. We'll have to look at that. But that's what we've got here, so that they're not kind of hidden as they were before, and you had to click a long way to find those. And I was thinking, as Julie Southwick was talking earlier, that having an Ehlers-Danlos syndrome FAQ would be possibly a good place to start getting more information on that condition. So, so that's our FAQs. And then in addition, we have this caring for your child and family section. And so that's where we put kind of all of the other content that's written for families, by families. And this is where our navigation has changed a little bit. We've organized them slightly differently. So in some cases, you'll see where my little mouse hand is. That's a page that I can click on, and there'll be content there. And in other cases, in this navigation area, you won't be able to click on something necessarily, but you'll be able to click and see information underneath it. And so we've moved things around just a little bit. I think largely speaking, things should be findable, or they're, hopefully grouped in a way that makes sense. But you might have to look just a little bit if you were coming to things before and you're just going to browse. We have redirects in place so that if you had something bookmarked, you'll be able to go to the right place there now. And here's our transition area. So that's really how we've made some changes to information, particularly intended for parents and families. And then we have our physicians and professionals section, and we've got 3 areas under there. So if you were someone who browsed the clinical content on our site before, you'll remember that we had information on newborn screening, positive results. So I think we've got 44 of these listed now. So we've got a section that's, again, just specific for those. We've also got an area that's where we look more in depth at quite a few chronic conditions in children. We've moved some of our shorter, more focused content around clinical conditions into this as well. So it's actually grown a little bit, and it was big already. So there's quite a bit here, and we're looking into making some changes in how this is displayed so it might be able to be seen a little bit more at a glance. And this is where we try and have frequently asked questions mirror this in-depth information in our family section. So this information here is really written for primary care clinicians, and it's written by specialists, and it's to help with kind of just-in-time information around treating and managing any of these 60+ conditions. And then providing a medical home. This is where we have some more focused information, including information around what the patient-centered medical home is, what care coordination might look like. So kind of these more medical home focused topics. And then we also have some common issues or more common issues that are seen in children and youth with special healthcare needs. Some of these are a little bit specific, but some of these are more broad and general, like pain management, self-injurious behavior, toilet training, skin and wound care, that kind of a thing. I mentioned that I would show you our guidelines and algorithms section, so let me do that here. This is the section that's probably growing the fastest on the medical home portal right now. And here's that outpatient urinary tract dilation care process guideline. So we've been working a lot with University of Utah and Primary Children's clinicians who are doing more and more of these care process models. And so when we're able, we are posting these on the medical home portal. All right. Okay, so let me go back to the home page. I'll just quickly point out our state partner project section, which will continue to be growing and fleshed out. We have these partnerships right now, and when something is happening within that state, we try and if it's relevant, of course, to our audience, we try and kind of highlight that. And in fact, if other Title V state organizations and family-focused groups want to come and learn from this, then they don't have to necessarily reinvent the wheel. So that's what that section is about. And now I'll go ahead and turn it over for the rest of the time to Athena to talk a little bit more about services directories and service providers.
Great.
Athena, do you want me to drive, or do you want to share?
I can share.
Okay.
Okay, so now you should be seeing the Utah Services Directory page. And so when you come to the medical home portal site, one thing that you'll want to do if you haven't bookmarked or done it already is to select the directory up here to make sure that you're looking at the Utah Services Directory. And then I've also already signed in to the account. So up here, you'll see some navigation for signing in. And then I can see, I can change my password if I want. I can see my list, or I can sign out. So that's where you'll find that navigation now as well. And then some changes to the directory is you can still search it all the same way. You can search by term, service category and or location. But now we have an alphabetized list of some of our broader top level categories as well. So for example, if I was looking for something on advocacy, I could see here that like, oh, there's all this information on self-advocacy support, and go right to that, get the map that shows the service providers listed under there. So and we are going to do some fine tuning to this alphabetized list because we realize that we all search things differently according to different keywords and phrases. So what we might think is the most common term may not actually be for some of these. So and then we also have still our suggest new provider buttons and suggest edit buttons. So here I could suggest a new provider if I knew about a resource that was coming, or okay, there's a bug. Whoops. So theoretically, very soon you'll be able to click on that and it'll produce a form. This was working earlier, so I actually wonder if it's on my end. Anyway, we'll look into that and make sure that that form is working. But if I'm within a specific service provider listing, this display should look the same as it did previously with, you can again search by term up here. You can see the map of all the services displayed. Let's try this one actually. I wonder if this button's working. Okay. So if I saw a listing on here that needed an update, I could go into it and also use the suggest and edit button. Here, so both those forms, we'll put in a JIRA for both those forms. And then this is how the actual service displays now. So you can see that it's got a little bit of a different feel, whereas before it gave you all of the information up front at a glance. Now it's got these sections that you can expand or close based on kind of what you want to look at about this particular service. And then the demographic information displays up top. So I was going to show you quickly how to go about adding some providers to a list as well, because it's also a little bit of a different feel. So I've got the May 2023 resources of the month list that I put together every month. So I was going to show you quickly how we can add to this. So when I sign in and go to my list, this display should look, it takes just you got to give it a second to load, but this is kind of, if you've got a bunch of lists, this is how they're going to display, and you can still go down to the bottom here and create a new one. And I can name it anything by clicking on the little button here. So I can name it that, and then I click the checkbox to save, and I can add a description, just kind of the same as before. I'm not going to save this one since that one's just an example, but if I go back to my list, I've started this one called May 2023 UCCCN Resources of the Month. So I've got it named, I've got a little description that it's service providers mentioned today. And then I've started adding a few of the things that were talked about, like our system of care, high fidelity wraparound, Utah Parent Center, pediatric medical genetics. So if I want to add the resources that Mindy just mentioned as those new resources, for example, I'm going to search them here. So the first was honey behavior. So I'll search it. Comes up. I know it's not displaying with the map right now. That is, it's something else we're aware of. When we put in new services, it takes a second for the mapping location to load. So when I pull it up here, this is how I add it to the list. You see how it's got the drop down for service categories and it's got these little check boxes. So I'm going to add it to this list by checking on the box of the category I wanted to kind of associate with it. And it brings up a confirmation screen. Are you sure you want to add it to this list? I say yes. And now it's on my list. And the way I know which list I'm working in is there's going to be a little bit of a drop down here. So then we can go back and add, let's add the Frisk Center too. Again, it won't have a map because I just added it. But, and I'm going to put this one under disability related employment programs. And click OK. And now when I go back to my list, I'll see that those have been added here as well. My list, and you can expand and contract these listings too if you want to see all the information about those services or not. So what questions do you guys have? The lists are all still shareable like they were previously with the URL. So here you can see I've shared this list already. If I get the URL, it gives me a unique URL that I can then share. I can copy this list, delete it, make a new list right here. So a lot of that navigation is similar.
Athena, this is Tony.
Yeah.
So if we had a previous login and password and stuff, will that just save over?
Yep. Everything that you created previously should still be there.
Okay, cool. Thank you.
Yeah. Good question.
Athena, do you want to just mention the note that can be printed?
Yeah, so there is an option as well to add notes to list, and the note section is a one-time use area that doesn't save. So for example, you could put protected health information in there. If you were directing this list to somebody specifically and you wanted to include a name or a birth date or something like that, you could use the note section. And at this moment, you're only able to, that would only be saved for, it would only display for printing purposes, one-time printing purposes, if that makes sense. So the information doesn't save in that box because it could contain protected health information, but that is an option. If you wanted to put a personalized note on a list you printed, it could, you could put one in this box. Any other questions?
Athena, I will just ask because I'm seeing it on the screen and reminded about it. How did you learn about the Honey Behavior Analysis ABA provider?
Somebody emailed us. I think the owner of the company emailed us. Yeah, somehow it came to me through Michelle.
Okay.
I think they might have actually completed our contact. So on the site, we also have this contact, the feedback form. I think they used the feedback form on the site, and that's how they submitted it.
Cool. Okay.
Yeah.
And one of the interesting things there was just that their telehealth options there's no wait. So that's a
Currently,
nice.
that's what it says on their website, that there is no wait for telehealth.
Cool. Okay.
Yeah.
All right. Well, thank you, Athena. I appreciate that. As you guys can see in real time, we are still encountering some hiccups, and truly it would be appreciated if you find those, if you'd let us know. And also, if you'll just be patient with us, because we're working out the bugs, and it's a process. But we're excited that we think our site will hopefully be a little bit more welcoming, and ultimately, once all the bugs are worked out, we hope more useful, and that's the goal. So we always appreciate your feedback if you've got any for us on that. Okay, I will pop up my last slide here again as we're wrapping it up, maybe. Share screen. There we go. Okay, so just a reminder that we have a couple of ways of connecting in between our meeting dates. We have our listserv that we love it when people do that. If you want to just send something to me or to Michelle, you're welcome to do that. We'll then send it out to the listserv, but it is a list that you're able to actually email directly to. So please don't hesitate. It's a wonderful way of staying connected to folks, and it's served its purpose really well when somebody's had a kind of urgent or a time-sensitive need, and we see everyone on that list really responding to questions or requests. We also have our private Facebook group where you're able to kind of do more, more of a social sort of a thing if you're into that, and we're still seeing how that's going, but we'd love it if you'd like to join us there. And if it should be findable if you just search for UCCCN in Facebook groups, and then I will admit you, or one of our admins will admit you. Our next meeting is 21st. That again is just crazy to me to think about, that we'll be halfway or almost halfway through the year at that point. I don't know how that's even possible. But I hope that between now and then you have a chance to enjoy some nice weather before things get too crazy hot, as we know they will. And of course, just be careful if you're around water, because boy, we've got some melting going on. It's been a wild year already, hasn't it, folks?
I was at Murray Park yesterday, and that river it looked like the Ogden River flowing. It was so, yeah. So be careful, guys.
Yeah, for sure. All right. Does anyone else have anything they'd like to mention before we wrap it up for today?
No, I just, as going through the cases, it brought to mind one of my now adult members that is also nonverbal, has cerebral palsy, but the parent is not at all involved. The grandmother is the contact person, but everyone has decided that he's his own guardian. And I just think if he's his own guardian and nonverbal, he doesn't have a guardian. I don't know. And lives in a group home, and I don't know. It makes me wonder what else could be done to make sure that he has an advocate.
Have we contacted the Utah Parent Center for him?
Haven't yet.
Let's do that first, and let's see where we can start navigating.
Nice.
Yeah.
Yeah, thank you.
And sometimes the guardianship can be an issue with the grandma. Like we generally will say we need to talk to the individual. But we can sometimes work around that in certain situations. So I think have grandma call us and at least give us a rundown. We have a lot of grandmas that call because, different reasons. So
Right. Yeah, it's tricky because she doesn't live in the same corner of the state as he does. So yeah, but I will. I'll have them reach out. So thank you.
That's what this is all about. Thanks, Jade. All right, guys, we'll let you go. Have a wonderful rest of your Wednesday and yeah, enjoy this gorgeous weather. Bye.
Bye.